We have all three of our presenters are here.
Okay. Good. Do you, Shivani? Nice to meet you. Do you, Shivani? Whenever it's like, and you, based on regular also speak on solutions. Oh yeah, you want to be the first person. So say for you, when you start, just if you want to start saying on the phone, okay.
At 16 now, so we'll start the webinar.
So we'll start like in about 5. So, we will start like in about 5 minutes.
We have some attendees with us as well.
Yes.
Oh.
Jeremy, can you hear me?
Loud and clear.
Okay, thanks.
Good, how about you? How was your Thanksgiving? That's good. Don't give out details because we're recording. Mine was good too. First time in years I went to my sister's. I hate traveling on this holiday, but I did it this time.
What is it?
Oh, upstate. She's in Poughkeepsie.
How about it from
A normal day, 2 hours.
here?
2 hours driving. Yeah. I left super early, so it was only about 2 hours and 15 minutes.
No traffic.
Little traffic. So once I got past Brooklyn, it was no traffic.
So like that way. So, in the city, so what's wrong? Good, right? No, I'm Big Sean. He's my colleague. I'll see you with her on that. You're the only one today, right? Yeah.
You get the email that I sent you from graduate student.
Yeah.
They're asking if they would have a couple minutes.
Yeah, we can, I know, after the
Yeah.
presentation, like around 7, 8. Oh, Katie did something. Katie is here.
Anyway. Polina? Okay. She says an attendee.
Move it.
Yeah, if any board member signs in, they ask for a blanket policy, is the weather.
Yeah, so anyone pretty much like count the call, even if it's.
No, they don't count towards quorum.
Like,
Their attendance counts, but
oh,
you gotta be in the room to count towards quorum.
Oh.
You're not gonna get it.
you-
You got a high number of quorum to maybe tell.
Inside.
Yeah. Kind of busy with all the languages
Yeah,
to read.
I know it.
Especially when I have to all three.
I went in school.
The undergraduate student also has opportunity to
I don't know.
vote about legislation in the council. This one seems public safety, but they're making
I'll get it. I'll see. So Natasha and Maria, right?
Yeah.
Both of them are out of state.
Oh, no, they both work today.
No, but for the meeting, like,
Yeah, yeah. No, I usually cover most of them. I've been training them.
no, they've been doing good.
Yeah, absolutely. I've been very happy. They're gonna, I'm on vacation next week, so they're gonna, this is why I get to go away. They're each gonna cover a meeting next week.
You prepare it very much.
Where you going?
This is recording off, this really. I go to Orlando every December with 3 friends for a golf weekend.
Wow. That's the consistent basis.
This is 9 years now.
Wow.
1 year we went to New Jersey. That was the COVID year. Yeah. It'll be a hell of a lot warmer.
Yeah. Probably people. Because I have to do something like that.
No, it's 2 different schools. I believe so.
Goes to win, maybe starting about.
Dude, you vote, huh?
In present, present. Yeah, both was, both, yeah. If you want to take it, what's the conflict? Then, the name and your file.
Not gonna make you do it now, but at some point, would you just sign in?
Sure.
You don't have to do it now.
What? Lost. I'm already lost.
Hey, how's it going? Yeah.
How you doing?
Jeremy.
Freddie.
Nice to meet you.
How's it going? John, Lori. Frank?
Jeremy.
Jeremy, Lori. Nice to meet you. I don't know where I heard Frank. I'm gonna sit right here. But cheer my people on. That's That's on. I'm freezing. Woo!
Alright.
Freezing. I love you. Oh,
We'll start in, 1 minute. Sorry, I'm trying to put that up and.
sorry for the lateness. It was the parking. Guys gotta get parking lots. It's Brooklyn. And I'm old. I don't like to say that. Let me tell you, I'm far enough to walk.
It's
Freezing.
You get younger as a day.
Well, the funny thing is I just say that just, it's not true. Cause age is matters to me. I just say that.
Do you have any presentation? You just wanna.
No.
We're just gonna do everything verbal. Hello everyone. We starting our meeting officially now, and with our first presenters are from. Oh, we're gonna do roll call first. I'll do that.
I will call roll. If you're joining us on Zoom, please remember to unmute yourself, acknowledge your name, and then mute yourself again. Let's start with Jonathan Martinez.
Present.
Thank you. Rosie Moda. Sylvia Agosto. Giselle Amador. Damien Andrade. Julia Bailey. Joan Body.
Here,
Thank you. Joan, you did not count towards quorum. Esteban Chavez.
Here.
Thank you. Maria Cruz. Jamie Freed. Nicole Huang. Cynthia Jeffers.
Present.
Thank you. Cynthia, you do not count towards quorum.
Thank
Susan
you.
Parker. Joanna Romero. Pat Ruiz.
Here.
Thank you. Pat, you do not count towards quorum. Kalina Sorma.
Present.
Thank you. Kalina, you do not count towards quorum. Michael Tom. Roll has been called. You do not have quorum.
Thanks so much. With that, we proceed with the meeting, and would like to introduce Baltic Street Wellness Solution. Is a community-based organization dedicated to mental health recovery and wellness. They provide peer-led support, advocacy, and holistic healing programs to help individuals thrive. Our presenters today is Freddie Grant, co-program director, and Vincent Wright, director of INSET program. With that, I'll pass the mic to them.
How you doing today? My name is Freddie Grant. I'm co-director of the Isaac Brown Healing Arts and Community Center, a program by Baltic Street. I'm joined today by Deshaun Wright from the INSET program and Lori Veet, the co-director of the Isaac Brown Healing Arts and Community Center. As you so eloquently put, we are a peer-led organization, actually the largest peer-led organization in the United States currently. And our community center is located not too far from here. We're at 33rd and 3rd. So the exact address is 882 3rd Avenue, Brooklyn, New York, in Sunset Park inside Industry City, if you guys know. We're literally here to do holistic arts. So if you don't know what that is, it's like being able to treat everyone based on holistic things like photography, music, and everything that encapsulates. Because for us, life is definitely better when you build community, and we have our whole center based on building community for people who need it or have it but want to just join something that's more accustomed to the things they're trying to build in life. So as peer led, I know a lot of you like, hey, what does peer led mean? It means that everyone within our organization has lived experience with everything that you might be going through and trying to push forward to. So like we've been through the rings and the rungs. We understand exactly what it means to be in that position that you are, and we're able to meet you where you are and graduate you to this level. So all of our people have been trained in APS, CPS, and all the other acronyms that people are like, I have no idea what that means, but
Alphabet City.
yeah, but it definitely means that we have taken the time and effort to be able to meet you wherever you are and help you. And some of the things that we do at the center is photography, music, poetry, art, like even crocheting and just production and everything else that you could possibly name. And that's right here in Industry City. And a lot of people don't know that we're here. So one of the reasons why we wanted to come is because it makes no sense for us to be here in a community and a community not to know that we exist. And a lot of things that we're looking to bring forth are like ESL classes, community engagement, GED, like all of these things. And we've been partnering with everybody who we possibly can in order to bring more awareness to the community that these things exist, because that's the most thing that we get, right? It's just like, oh my God, I never knew that this was here. I never knew that these things existed. And Baltic Street, out of weird places, like we're the only people who do what we do. Like there are a lot of other agencies, there are a lot of other like clubhouses and memberships, but they don't do what we do because we are a safe space that's also no referral needed. You can walk in, all you all you need is just to walk in the door and have like a want to be a part of something. And even if you don't, you can come in and just like, hey, I'm just gonna sit here and be quiet and just watch what's going on for the rest of the day. And we're fine with that. Because again, we meet you where you are. And right next door to us is the inset program. So Deshaun can take it from here and tell you a lot about that.
So Deshaun takes it.
Wait.
A couple words. I might be freezing. But if you've all seen the mural at the elementary school on 37th Street, we were a part of that. It was the Department of Health and Mental Hygiene. And we went into the elementary school and we had the kids. So when you see that father reading to the son, that wasn't us. That was the kids talking to us. So Freddie's here about all the good we do, and we do so much good. What I'm here is, I need help from the Sunset community, because one, I know I don't look like people. Two, my Spanish is poquito. And I feel that, like, we're willing to, like, have mothering classes at our center. We're willing to, like, have people come and do their own kind of PTA meetings. Like, we are open to anything. So for me, I came to talk about the barriers more than, and again, it is what we do, but for me, it was also the barriers that we face. So I would appreciate that people in this community just come and visit us, see what we do. Let me give you pamphlets. Talk to your friends, your neighbors, in this community, because we are open. We're open to so much, that people don't understand, and everybody looks for a safe space. Everybody. We used to say to them, well, your kids are in school, you need a place to meet here. Mothers groups, even a father's group. I'd love to do a father's group. So again, I came to ask the community to help us help the community. So thank you. Oh, that was me. And I'm gonna hit you with the Sean. From Inset, thank you.
Thank you so much.
Thank you.
Yes, as they mentioned, my name is Deshaun Wright. I am the director of the INSET program.
I don't think they hear you.
You put closer to the mic.
Sorry. Excuse me. Again, my name is Deshaun Wright. I am the director for the INSET program with Baltic Street Wellness Solutions. And what INSET stands for, first, the acronym is Intensive and Sustained Engagement Program. And we are a voluntary, peer-led, community-based engagement approach designed to support adults who are historically marginalized, undeserved, and unserved by traditional mental health services and systems, and or who may be at risk of involuntary commitment. NSET teams aim to support these individuals by identifying and reaching their unique value life goals, connecting individuals and communities, and providing 24/7 intensive and sustained support to participants in their community. And essentially, what we aim to do is use the holistic models like 8 dimensions of wellness to support individuals in any life goals that they have. Anything from doing laundry, managing medication, navigating services, finding social groups, financial literacy, literally any kind of goal or achievement that they have, we have their support to help them achieve these goals. And our goal also and model of the program is not only to help individuals achieve these goals, also empower them with the tools and skills so that they can go forward in the future to do it on their own. A lot of what we do is empowerment of people and finding voices and advocacy for themselves. And so promoting those things by giving them education, resources, support, helping them even navigate things like transportation so that they can get to their appointments or visit friends and family, or helping connect them and coordinate services for medical and mental health care. So we're constantly working with community partners and outreaching and engaging to constantly keep our resources and keep that line of collaborative work so that we can use that to support the individuals that we serve. What makes us distinct from other peer-led programs and other intensive programs is that we really believe in the voluntary and the voice of the participants and individuals we serve. They lead the train of their lives, and we're just the supporting wheels to help them get on track to where they want to go.
Meet people where they're at.
Yes, it's a major model that we follow. So meeting people where they're at.
I do have a follow-up question for both of you. Can you please elaborate more on the requirements? For example, like what's the target, like of your programs exactly, like, or like more about that specific?
So I'm gonna answer that in two ways. So Baltic Street as a whole has 17 programs that we have. NSET and the community center are only 2 of those. So, and generally, depending on which program or what you need, but specifically for the community center, there are no requirements, no referrals needed. You don't have to have any diagnosis, anything. You don't have to even have any ID or none of that. All you want to do, just come. And we will bring you in. We will introduce you to all of the services that we do, everybody who we can connect you with. And that's anywhere from like job services to dealing with like OBT, or if you're just trying to say like, hey, man, I'm just trying to heal myself holistically and I just need an outlet, we can do that. Anything that you want to do, even if it's like Lori said, something that we don't currently have, we will definitely look into facilitating it for you if we discover that that's a need for the community.
Correct. Correct. And that's the biggest thing, because we are located in Sunset. We want to hit the community. And again, the community down in Sunset is becoming extremely diverse. So come to us. You bring me 10 people, 5 people, I'll give you space for a group. You know what I mean? Like, I'll run the group if it's something that, well, my friends and I want to come or whatever. So, my barrier is, like I said, my Spanish is poquito. My Mandarin is nothing. You know, and that's how the diverse community is coming, and this is where I would like to help. I would love somebody to come and tell me, oh, we'd love to do this. So help me. Help me. Bring, bring your friends, your neighbors, and we'll figure it out. Cause we have the space. How big are we? Like 25,000 square feet? I'm like, we're big. And Inset's right next to us. So usually when you go to Inset will bring you to the center. Because again, we have podcasting, we have music, DJing, hydroponic gardens. I mean, again, you could have everything planned out for tonight. Stuck with the parking.
Sorry, I need to.
So sorry.
Yeah.
Yeah,
But I'm done
and
anyway.
some people in virtually that will not be able to hear you.
Oh, they
Yeah,
hear me?
But please, Michelle, tell them about what you need to.
What do you need for
Yeah,
your?
so my specific criteria for the NSTEP program is, we service anyone at least 18 years or older who have been identified as high risk or complex mental health needs. So anyone who has recurrent, hospitalizations or maybe recurrent, being arrested or incarcerated recurring due to mental health, some situations that may occur, we service those. So anyone just at high risk of mental health needs in general. So that includes people who may be at risk of AOT orders or any court mandated orders, or may have AOT or vaccine or acting. We want to become eventually that intervention or intervening piece before we get to these traditional health systems, and create the voice, so that our participants are inclusive in their treatment, inclusive in the things that they want to see happen in their life that's regarding their physical and mental health.
So one thing that I do wanted to bring up to your attention. I think if you like.
Oh, what? Me again? I gotta repeat everything?
No, I mean,
Okay.
if you want to.
No, I'm good. Oh,
So, just for awareness, we do have a newsletter, the community CB7 newsletter that goes to the community.
I get it.
district. So, something that we can collaborate on is, for example, if you have like a specific event or a specific program that you want to promote, we can promote that to the newsletter that we have in the community.
I can send it.
Yeah.
So who do we send it to?
Well, district staff.
So I was gonna,
Okay.
Okay, no, we could even talk about that after the fact.
sure. Sure, you are not profit,
Not for profit.
then we're. I would also suggest you might want to reach out to your elected officials and maybe have some sort of open house for them
I've
to show
tried,
them your facilities.
I've tried.
We can help facilitate some of that.
So if you could, again,
I would also say,
when I came for the barriers, that's a barrier that I found.
well, I would also say I was confused myself when I saw Baltic Street, because that's not local, that's community district 6. So to hear you were in
32nd, 33rd, community district 6.
Baltic Street itself,
About the
Oh,
agency
not
itself.
The agency itself.
Agency itself. The healing center is in.
the street, Baltic Street in Brooklyn.
Okay, but we're not, that's just our name.
I'm saying that's what was confusing, because it sounds like you're in another neighborhood.
No, so we started in 1996 with 6 people, and we've turned into 120 people, 17 programs from 1996 to now. All right, and I've been a part of this for 15 years now. But again, and I hate to my issue, because I'm not bringing anybody else in, is the community engagement. Because we have, Freddie and I, the networking we've done, but I need more networking. So thank you. We'd love to be able to advertise some of our stuff in your newsletter.
That definitely can make that happen, and could definitely have a broad discussion, offline. And,
Yes.
that was something they wanted to bring up to everyone here.
We are Sunset Park.
Yes,
Cause the truth, my boss one time said to me, and what are you doing in Sunset Park? Like, come on.
I mean, cause
I'm doing my best.
piggyback off of that, like literally, us, and I know INSET is in the community program. So everything that we're doing is for the community, but you can't do something for the community without the voice of the community. So anything that we can do to further that reach, to get more voices, so to be heard, is what we're trying to do, because obviously there shouldn't be a conversation about us without us.
Right.
And I totally agree, and that's the main reason that I reached out to you guys, and the reason that you guys here. It's part of the getting to know your community, getting to know like what is in the community, and how can we benefit the community and the community can benefit from us. So that's a big conversation, but just to talk more offline about this. You'd like to make any final remarks?
I guess like, finally, I would like to say, so again, we are an agency that has 17 programs, some of those like peer advocacy, INSET, the community center. Like, we have so many things that we are trying to do for the community. And honestly, we don't want to do this without the community, because a lot of the agencies and places that are around right now, they're just moving in a direction that's just like, well, are we still peer-centered? Are we still person-centered? Are we still on task? And they don't have any checks and balances to say, like, hey, this is where we're going and this is what everybody wants. It's just like, no, this is what we believe in, that's what we're doing. But at Baltic Street, thanks to people like our courageous CEO, Taina, and everybody who at the agency, we're literally trying to say like, hey, we're gonna combat loneliness, we're gonna build a community, and we're gonna actually listen to the members of that community to move on.
Correct.
Any final remarks before we open to questions?
Yeah, a lot of, the purpose here is to get the awareness of the program here, because like I said, along with all the programs that we offer, housing, employment, training, entitlement, education, empowerment, self-help skills, these are the views we have to move forward holistically, and we want to implement in the communities. So like I said, how are we serving these communities? If no one knows about us, if we're not as present, if the word of mouth is not spreading, and we really have a lot of things we can offer to benefit the community and feed off of how we can improve as well. So, and specifically for NSET program, wanting to really steer away from these traditional healthcare systems that don't give people the voice, don't focus on what people need holistically, focus on treatment and the problem and not meeting people where they're at, and how we can use the skills that they have to build on these things to help them be better, healthy, and have more full quality of life.
Any final remarks before we open to questions?
Uh,
Okay. And we will open it for questions to the room and to anyone virtually.
If you're joining us on Zoom, please use the raise hand function if you have a question.
We can start with.
Yes, I think so. Yeah. What are the hours of operation for the community center? What are the times that people can come by and
That's
find out more about programming?
Yeah, so that's a perfect question. Right now, we operate from Monday through Friday, 10 a.m. to 6 p.m. But as programming goes on in the future, we're looking to do other things. And to piggyback off of that, right now, our programming is from 18 up. But again, in the future, we're looking to do more introspective things just as demand builds.
but if you call our number,
And what is your number?
it's 917
917
803
803
7123.
7123.
You can get me on a Saturday or Sunday.
Saturday or Sunday.
Cause I'm not there, but I will pick up the phone.
All right. Thank you.
You're very
Same
welcome.
number for,
Yes.
okay, so the same number for
For
the,
Freddie too.
for
For
Freddie
the weekends, yes.
and for the,
Inset's a different number.
Yeah, so INSET program offers a 24/7 crisis hotline. So we are available 24/7 as a program, at least as a phone hotline, where you can speak to an actual peer specialist, or even me as a director, I get the phone calls too. And we try to navigate support no matter what time it is, try to give you some sort of connection and resource to help you in that moment. So we are available 24/7, at least by phone through the crisis hotline. But we operate as peer specialists Monday through Friday, typically, around 8:35. But again, it's really based on the need of the participants we serve. So we're always flexible and always, can be reached for support.
So come and visit us.
Yeah.
He's literally right next door to me.
Um,
So you've got two birds with one stone.
I don't see any additional.
no additional questions, and, thank you so much for coming and presenting, and we will definitely have a bigger discussion offline. And, thank you again.
thank you for having us.
Yes, thank you for having us. Appreciate you.
And please remember to sign it
Thank
before you
you.
leave.
Oh, thank you.
I will on my way out. I'll
And
sign it on my way out.
for the next presenter, we'll be having Shivani Javier. And feel free to get comfortable, so we can start the next presentation. Thanks so much. Any material, you can leave it with, him, and then you can put outside of him.
Give them all, yeah.
Yeah, just give me a clip, but you're more than welcome to put them on our table.
Oh, thank you.
Thank you. Nice to meet you again.
You too.
So, let's again here. No,
You may need a better view of the screen.
Yeah. Um. Right, so
See, I have.
you have your.
Oh, you need to come to us. We have a feeding our mental health. You need to come to us.
So, this, I will move to the next presentation. Like I say, this presentation will be done by Shivani Mahadir, which is, from One Brooklyn Health. And One Brooklyn Health is a healthcare network serving the central and eastern Brooklyn, focused on improving access to quality care and addressing health disparities. Their program emphasizes nutrition, chronic disease prevention, and community health education. With that, what is yours?
Good night, everyone. My name is Shivani Mahavir. I'm Director of Clinical Nutrition for One Brooklyn Health and registered dietitian. Tonight, I am going to be speaking about all things nutrition. No, I'm joking. Tonight, I'll be speaking about nutrition as it relates to the management and prevention of chronic diseases. Again, I do have affiliations to One Brooklyn Health. Really, what is chronic conditions or diseases? Chronic conditions are long-term health conditions that progresses slowly over time. Some of these include heart diseases, diabetes, cancer, hypertension, obesity. How nutrition plays a very crucial role in its management and prevention. It does so by preventing diseases onset. So if you're you're eating more health conscious in the beginning, it will benefit you in the long run. It helps to manage symptoms in terms of if you're hypertensive, looking at your sodium intake, if you're diabetic, looking at the amount of sugar that you're eating. And then it also improves quality of life, and we will get to that as we get into the podcast. It is actually one of the most cost-effective interventions because as conditions progresses, eventually you end up in hospital. Hospitals are very expensive. So if you have a proper nutrition along with lifestyle changes, it can prevent and delay set of chronic conditions. Again, yeah, we're on the right side. Chronic conditions are those that last more than a year and they require medical attention. Some of the most modifiable risk factors, again, are poor diet, physical inactivity, smoking and alcohol, and lack of sleep and stress. So those lifestyle changes. Good nutrition can reduce up to 80% of heart and type 2 diabetes risk. So again, it all comes down back to food and what we're eating. Poor diet also contributes to high blood pressure, high cholesterol, insulin resistance, automatically leading to risk for diabetes, systematic inflammation, excessive body weight, and oxidative stress. Eating healthy, obviously, can help to decrease these conditions. Now, what are some of the key nutrients? Fiber. Fiber is everybody's friend. I can't stress it enough. Everybody comes in and they're like, well, what's the secret? What is the one size fit all? There's no one size fit all, but the more fiber one is to include in their diet, the more beneficial it is, especially when it comes to managing blood sugar and cholesterol levels. Obviously, eating those healthy fats, and no, we're not talking about McDonald's and all the fatty foods. We're talking about the olive oil, the fish oils, the foods that are high in omega-3s and 6. And then obviously antioxidants. Antioxidants are very good because they do reduce inflammation and oxidative stress. Any of the berries you may consume, they're very good to have. They're very anti-inflammatory. Lean protein, that is what we stress. We obviously, I know Thanksgiving just finished. A lot of us have turkey. Turkey is considered a lean protein as long as you eat it in moderation. So you want to focus on those lean proteins, so those chicken, the fishes, the turkey, beans, those are all good things to have. And obviously, having adequate vitamins and minerals. So your vitamins A, B, K, your fat soluble vitamins, having enough magnesium and potassium for heart health. So key pointers for disease and chronic condition management are these listed here. Now, we're just going to go in very lightly about how nutrition impacts heart conditions. Obviously, if you are living with heart diseases, you want to limit the amount of trans fat, saturated fat, and added sugars you're having. So, the McDonald's, the KFC, the Popeyes, those you want to make sure that you're not having in excess. You're focusing on the healthy fat. Processed meat, you want to again make sure you're focusing on lean protein. So, not the pepperoni and all the cold cuts. You want to make sure you're looking at those. And if you're having the cold cuts, because obviously we'll get to that, food should be something that you love and enjoy. You want to make sure that you're having the ones that are in low sodium, so not regular. You want to make sure when we are living with heart disease and heart conditions is that again, fiber is your friend. You want to make sure that you're increasing diets that are high in fiber. So you have the soluble and insoluble fibers. You just want to make sure that insolubles are the ones that do not dissolve in water. The barley, the oat, the quinoa, you want to make sure you're incorporating those. Or the soluble ones are again those berries, those green leafy vegetables. And the importance of fruit and vegetables because they do have all the vitamins and minerals that we need. So you want to make sure that you're having at least 5 servings a day. In the results that what that'll achieve is that it'll lower blood pressure, reduce cholesterol levels, and improve arterial health. Nutrition in type 2 diabetes is one of my favorite areas. A lot of diabetes complication you can reverse back simply by eating the right type of food and what we put in our body in moderation. And what we stress as dietitian is having a consistent carbohydrate intake of during your meal to have a certain portion size throughout your meals. That helps to control diabetes management. You want to obviously choose foods that are low in glycemic index. Here again, it tells you about increasing that fiber intake and including healthy fats with your meal. You want to make sure you're avoiding sugary beverages, sodas. Even the diet sodas, they do have artificial sweeteners in them, so you want to be mindful. So what we do advise is if you're feeling that buzz, is that I always tell clients of ours is to have a cranberry juice, add some salsa water in it so that you'll have that bubble in the fizz and you'll have some of the sweetness. Obviously, cranberries are good, they help with urinary, but we can get more into that offline too. And it helps to control blood sugar levels when you're having some consistent intake. Yep. Nutrition and diabetes, obesity. Obesity is very common in the Americas, especially here in New York City. Obesity rates are very high. What we want to do when we're living with obesity is obviously look overall at lifestyle changes. You want to make sure that you're having a balanced caloric intake. You're looking at those portion control. You're consuming minimally processed food. You're keeping yourself adequately hydrated. For women, we recommend for you to have at least 2 to 3 liters of fluids a day. For men, 3 to 4 liters. The good thing is that the human body doesn't care where it gets fluid from. Obviously, you want to give it clean sources so it doesn't have to break it down. So we always encourage water. Obviously, if you're a tea drinker, that's good. If you like soups, that's liquid. You have like coffee. There's so many varieties that you can break down. Or even if you're having plain old-fashioned water, you could add flavor. You could add fruits into them. You could add mint leaves. You could give it a little bit of splash. Then you're not having plain old-fashioned. And then obviously behavioral changes. Be more mindful of what you're eating and what you're putting in your body. One reaction follows the other. Nutrition and cancer prevention. There are so many studies that shows the importance of eating a proper nutrition, having a proper balanced diet when it comes to cancer. And it doesn't matter what type of cancer, you obviously want to be mindful of what you're eating as it relates to it. You want to make sure that you're having a more plant-based diet. So all those green leafy vegetables, all those broccoli, cauliflower, asparagus, you want to make sure that you're incorporating more greens into your diet. As I said, the cruciferals, cabbages, broccolis are very good. You want to make sure that you're limiting red meat and processed meat. So the steaks are a big no-no, especially even in cardiovascular health. But again, everything, if you're eating, if you do so in moderation, it's good. And then you want to make sure that you're increasing antioxidant rich food. Nutrition and hypertension. Well, we talked a little bit about heart conditions. Hypertension in the Americas, we make sure and we encourage to follow the DASH diet. DASH diet is dietary approaches to stop hypertension. And it's very similar to a Mediterranean diet where they're focusing a lot more on the veggies and the lean protein on your plate more than the carbohydrates and the other food items. You want to make sure that you're reducing your sodium intake when you're having your meal. So again, if you're a cold cut eater, have those that have reduced sodium in it. If you're having canned goods, make sure that when you're reading your labels, they have reduced sodium. You want to make sure that you're increasing potassium-rich foods, so your bananas, your spinach, your beans, as long as you do not have any kidney condition. And obviously, you want to make sure again that you're hydrating adequately. Again, some of the diets that we talked about, or I just mentioned, are the Mediterranean and DASH diet. They're pretty similar. If you compare the two, you want to make sure that the concept is implementing more plant-based into your diet and focusing less on the other components of your plate, and we'll get to that and your very old-fashioned my plate. Everybody laughed at it, but it is so true. If you can stick to this, you can do wonders. it is very much the key to all dietitians and what we counsel and what we train with our clients is that you want to follow this plate. If you follow this plate, then there's very minimal that you could do wrong with it. You want to make sure that you're incorporating at least half of your plate should be vegetables. You want to make sure the other half is split evenly between your lean protein and whatever whole grain that is. You want to make sure that you're using herbs and spices instead of salt. You're preparing your meals at home and you're not purchasing outside. And obviously, if you're purchasing outside because of your busy schedule, you want to be mindful of saying, hey, maybe I'll go to a mom and pop store instead of going to McDonald's and picking up a burger. Obviously, again, you want to make sure you're having some healthy snacks in your diet so you're not waiting long periods between meals so you tend to overeat at the meal. So you want to have like some nuts, some grains, and some trail mixes in handy to you so you could have those in between your meals. And again, drink a lot of water. And lifestyle changes is that in addition to eating healthy, if you do not incorporate exercise into your lifestyle, you're only giving yourself 90%. And why do that? Exercise is very important. You want to make sure that you're having about 30 minutes of moderate exercise, so if that be walking, cycling, or at the gym for 30 to 45 minutes for 3 to 4 times a week is what you want to aim for. If you're busy and you can't go to the gym or walk outside, you want to make sure that you're home. There's a lot of home remedies. I always tell clients of mine, pick up a can of tomato jar. The older you get, the more fat you gain and more muscle mass you lose. So you want to hold it like a dumbbell and you want to keep exercising. Those are all good techniques to do. You want to make sure that you're having adequate amount of sleep. That is about 7 to 9 hours of sleep. You want to make sure that you're managing your stress. Meditation is great. Deep breathing is great. Don't get yourself into situations that you do get worked up. I always believe in the count 1 to 10 and count backwards or just move yourself from the situation. And as I said, diet works best when you combine it with these lifestyle changes. Some of the barriers that we do have to healthy eating obviously is cost and accessibility. We've heard a lot of people say, oh, organic food is better. Organic food is better, but it does have pesticides. It contains up to 5% of pesticides. So it's really what you can reach. If you're at a supermarket, pick your greens up. It's okay. It's better to have some greens than no greens. So you want to make sure that you're shopping in those grocery sections. Busy schedule also makes people more limited to eating healthy. So if you can meal prep or prep ahead, then that's good to have. Visit your food markets. It's very good. And cultural preferences here in the Brooklyn area, we have a very diverse culture. All our cultures incorporate some type of protein, some types of carbs, some type of vegetables. It's just how you portion it on that plate. It's very good to have. So again, you want to make sure that you're meal prepping. You're looking at foods, even in the grocery section. If you cannot afford to buy fresh produce, then you can buy frozen, have them blanched very quickly and have it. But there is nothing wrong with that. Something is better than nothing. And finally, nutrition is really central to preventing and managing chronic diseases. We encourage to focus on whole plant-forward diets, which reduces risk factors. Small changes create long-term benefits, and a healthy diet is a powerful tool in improving public health. At One Brooklyn Health, we do offer great services in terms of cardiovascular, diabetes. We do have a diabetes center for excellence on Eastern Parkway. So we do have great programs and community outreach clinics within OBH. And we do have dietitians there that are eager to help our community. So if need be, please stop by, make an appointment. We're happy to do preventative care. It's always best to do it prior than after. And that is my presentation. Any questions?
I'd love for you to come speak.
Thank you so much. And I will open it for questions, virtually or in the room. And really, really great presentation.
If you were joining us on Zoom and you have a question, please use the raise hand function. Should I just call him?
Yes.
Alita Sorma?
Hi, thank you so much. That was a great presentation. I couldn't help but think about my father during the presentation. He has diabetes and he's pretty thin, and they prescribed him Ozempic, and I was like, oh man, this is gonna get worse. So he typically does not have an appetite, and but he makes sure to eat because of the medication. But do you have any recommendations for increasing appetite in a healthy way for those type of circumstances?
I do. Ozempic is one of those medications that the way they work is that they make the food sit longer in your stomach. It delays transit time to the digestion process. If that is not a strong eater, maybe you might want to focus on some of the food that does like and incorporated, that it's more visually in sight for him that he's eating it. If he's not really for meals and he is picky, we do recommend supplementation over the counter. There's some great diabetes products that you can use, but really not given large portion sizes to that. It's just a small, frequent meal that should help. And if you do have more questions, then I'll be glad to take it on an individual basis.
Thank
Any other hands?
Thanks so much for coming today and for presenting about this very important topic to our community. And we do have another presentation from the New York City Department of Health and Mental Hygiene. Dr. Williams.
Okay, this is from Dr. Seltzer.
All right, so can you give them what presentation to you? And then I'll do a presentation for them, and I'll pass the mic to them. So to present about breast cancer, I would like to introduce Dr. Beth Seltzer, Executive Director of Clinical and Scientific Affairs Unit, and Dr. Samantha Williams, Executive Director of Program and Operations at the Mental Hygiene Division. Both are under the New York City Department of Health and Mental Hygiene, which is dedicated to protecting and promoting the health of all New Yorkers. The department works on a wide range of initiatives, including disease prevention, mental health services, health equity programs to improve the community well-being. With that, I'll pass it to doctors.
Apologies, I couldn't quite hear the end of that. Was that an invitation for us to go ahead?
Yeah.
Okay, great. I will take a second to share my screen. And just before I do that, I just want to check in. How much time do we have? I don't want to go over and keep people here too long.
30 minutes, 35, 40. Depends
Okay.
on, just go ahead and do your presentation. Don't worry.
Okay, half an hour. I should work great, and I hopefully will have some time for questions. I'll keep an eye on the clock. So let me just share my screen here. Bear with me. Hold on, I just want to get this set to do this as a slideshow, so bear with me. Okay. Okay, can everyone see that?
Yes.
Okay, great. And just to kind of just redo the introductions a little bit. So Beth Seltzer, I'm a preventive medicine physician with the health department. And Dr. Williams, who's joining me, is also a preventive medicine doctor. And she's newer to the health department and our program. So I offered to be the main person talking today. And she's going to kind of back me up and also chime in on a couple of pieces. And I'll explain in a minute, but she's been working on some interesting projects and research around breast cancer. So hopefully we're the right team to share information today. So this presentation is going to focus on really having fewer people in New York City suffering from and dying from breast cancer. That's our program's goal. And so we're going to focus on steps you can take to reduce your cancer risk and detect breast cancer early. So in plain language, that's breast cancer screening, and then also things you can do to reduce your risk. And if I can get this to advance, I will. Hold on. Okay. So first of all, a little bit of grounding in national breast cancer numbers. So breast cancer, I think, as we're very familiar with, is more common in women than in men, and it affects about 1 in 8 women in the United States. And numbers in New York City tend to be pretty similar to national for this. And every year in New York City, we have about 6,600 new cases, and we lose about 1,000 New Yorkers to breast cancer every year. So, something we'd like to see improve. And in fact, if you're familiar with our department's Healthy NYC initiative, we actually have a citywide goal to reduce deaths from all the cancers that we screen for by 20% by 2030. So that's what we're hoping to get to. And so the thing to know for this talk is if you can find breast cancer early, it's actually very treatable and it's often curable. 99% of women who have breast cancer found when it's very early are still going to be alive 5 years later, and many of them much longer than that. So the whole point of screening is to find it when it's still really easy to treat. So this slide actually just shares a little bit about our numbers here in New York City. And we're focusing on mortality here because that's what we're trying to combat. And if you look at the black line, that's New York City overall. And you can see that over the past 20 years, the good news is that's been going down, even though cases of breast cancer have slowly been starting to climb upward. So as a city as a whole, we're doing well. But another thing that you see here is that if you split things up by what we call our racial and ethnic categories, not everyone is having the same good outcomes. And excuse me for just a minute, I'm getting over a cold. Sorry. Um, so we just wanted to share this so that we can just kind of see that it's not the same and it's not fair for everyone across New York City. And one thing to know about these groups is these are social groups. These are categories that we as a society put people into. Not everybody in the white group has the same genetic background. Not everyone in the Black group or the Latina group or that's Asian and Pacific Islander group comes from the same place in the world or has the same history. And yet we tend to see these patterns over and over and over again. So one of the things that we're working on in our cancer program is actually trying to get that top line, that red line for Black women down. We'd like to see that line at least as low as this whole citywide numbers. And by doing that, we hope we can actually drive down numbers for everybody even more. And so we're attending to people's access to care, the things that make it hard to get good care. And on a broader level, we would love to be tackling the environmental and social structures that cause us to have these differences. One small thing that we do as a program is we fund mobile mammography services. So we fund one of the groups that has a mammo van. And we've asked them to go to the neighborhoods where women are dying of breast cancer out of proportion to other places in the city. And they provide full service. They will help you get signed up. If you don't have insurance, they will help you get a free screening. If you have a positive screening, they will help you get to diagnosis and care. And so that's another thing that we are hoping through our work to promote in all of our ways of getting screened all across the city. That you get there, you get a great screening, you get follow-up, and you get good care. Another thing we've just launched, we're calling our Breast Cancer Task Force, and that's our name for our program that's trying to drive that red line at the top for Black women that's trying to get that mortality rate down. So what about folks in the room here? What can you do as a person to lower your own risk for breast cancer or increase the risk that if you are diagnosed with breast cancer or if a loved one is diagnosed with breast cancer, that the outcome is good? So one of the big things you can do is you can get screened. And I'm going to talk more about that in a minute. Another thing you can do is know about all the people with breast cancer in your family. The more you know about the history, the more you can tell your primary care provider, and the more you can figure out what screening do you need, what schedule should you be on, what else do you need to be aware of. Another one is especially for older women, my age group and up, for folks who are using hormone replacement therapy for menopausal symptoms. It's kind of complicated. Not all forms of hormone therapy are going to carry extra risk. We think we don't fully understand this, but there's some indications that some kinds of hormone therapy can increase your breast cancer risk by at least a little. So if that's something that you're choosing to do, just make sure you talk it over with your doctor, with your healthcare provider. Another one is if you're in the age to be having babies, breastfeeding actually we think can lower your risk of breast cancer at least a little bit. Staying at a healthy weight is another thing that can lower your risk. Now, what do we mean by that? I will say that healthcare in recent years has done a really good job of shaming people about their weight, and we certainly don't want to do that. The thing to know about your weight, or more specifically, the amount of fat tissue you have, the medical term is adipose tissue, is that adipose tissue actually does things in your body. It makes hormones. It communicates with other parts of your body. It can be involved in inflammation. It can be involved in how you process the foods that you eat. And so there seems to be something about having a high percentage of adipose tissue that can raise not just your breast cancer risk, but your risk for a lot of cancers. So if you can do what our previous colleague was talking about and try to aim for healthy diet, if you can do the next thing on the list, which is exercise regularly, there seems to be a good chance that you can drive your breast cancer risk down a little bit. So that's why we have this here. And then exercise on its own is known to be a good way to reduce your breast cancer risk and your risk of other cancers too. Drinking alcohol, even small amounts, they've been able to measure as low as 1 drink a day. Below that, it gets hard to measure. But drinking alcohol raises your breast cancer risk. And the more you drink, the higher your risk. So if you choose to drink alcohol, moderate that intake. And then medical imaging, we know that if you need to have, say, a lot of CT scans for another condition, if you need to have radiation therapy to treat another cancer in your chest area, that can also increase your risk. So it's just something to know about as you're going through other healthcare experiences. Dr. Williams, anything you'd add there? Did I miss anything?
Um, no, I think you got everything, and emphasizing the importance of screening, discussing with your healthcare provider how often you should get screened, and as well as women in your network, whether that be sisters, aunts, nieces, daughters, friends, um, colleagues, people you're familiar with.
Yeah. Yeah. So for your own personal risk, knowing about all those folks in your family, and then for helping us get these breast cancer death numbers down, right, is talking to friends and colleagues and spread the message. One other thing I wanted to add about weight, because I was actually just reminding myself about that today. For some reason, having excess fat tissue seems to be mostly an issue when we're postmenopausal. and less of an issue when we're younger, except there's a concern that it might actually make us more likely to get the more aggressive cancers. So we're very much still learning about that. But the American Cancer Society does just recommend, do what our colleagues said, try to eat healthy, try to exercise, and just, try to stay healthy all around. So moving on to the next slide. So in addition to these kind of things that can happen and change in our lives, there are some things that, just are innate to us. So one thing is as we get older, most breast cancers happen as we get older. We kind of think, 50 is sort of a cutoff, but actually 15% or so of breast cancers happen in women who are younger than 50. So just because you're younger doesn't mean you cannot get breast cancer, but as we get older, the risk definitely goes up. Another thing that can be innate to each of us is having an inherited gene change or genetic mutation. So I bet a lot of people have heard about the BRCA genes, BRCA1 and 2. So if you have a specific genetic change in your family that causes a lot of people in your family to get breast cancer, then that's something that you just need to know about so you can take the right precautions. Starting your period a little early, before age 12, or starting menopause, just statistically a little bit late after age 45 can actually raise your risk a little bit. Having dense breasts, which I'll talk about more in a second, but that actually can raise your risk. Obviously, having a family history of breast cancer or ovarian cancer. And then we talked about radiation therapy. And another one that not everyone knows about is there was a drug that was used for pregnant women. Actually, I have to just check. I think that was a nausea medication. Is that right, Samantha? Let me double check. Oh, no, I'm sorry. That was a medicine to prevent miscarriage. And that was used back in from the 40s to the 70s. And it was found to increase breast cancer. What's important to a lot of us now is that the daughters of women who took that drug also seem to be at a higher risk. So again, just something to know about as you're thinking about your risk. We had this in here when we were in the room with you that we had some Q&As, but I've already talked about this. Men actually can get breast cancer, just much less often than women. It's more like about 1 in 700 for men versus 1 in 8 for women. Okay, so when do we get screened for breast cancer? There are actually some different guidelines from different organizations, but more and more folks seem to be agreeing that if you don't have any special major risk factors for breast cancer in your life, the age to start is age 40. And you continue as long as you're in good health and expected to live for at least 10 years. Now, should you get screened every year or every other year? There's been a lot of conversation about that in the medical world in recent decades. The United States Preventive Services Task Force, which is the one that often influences insurance stuff, they're actually recommending every other year. The American Cancer Society is recommending every year, especially for younger women. And as we get older, we can decide every year, every other year. There are some other major organizations that say just every year for everybody. So this is a good one to talk to your own healthcare provider about. And you can talk about your own risk tolerance and what you would like to do and see what they recommend for you. Now, what if you're younger than age 40? Are you off the hook? You are not off the hook. So if you're younger than 40, the thing to do now is to go and talk to your healthcare provider about your family history and find out if you are actually someone who should have genetic testing, if you are actually someone who's at high risk, because screening can start much earlier for people who are at really high breast cancer risk. So go find out now and find out if you're someone who needs to start early. Also find out if you're someone who needs special screening, which we will get to in a second. One other thing I want to add here, which is that when we talk about breast cancer screening, we often use the term women. A lot of the older studies in screening were in women. And nowadays, as people are having broader thoughts about gender, one of the major organizations that does screening recommendations, the United States Preventive Services Task Force, is now saying when we say women, we mean people who were assigned female at birth. So we mean cis women, we mean men people who are now men who were assigned female at birth. So we mean trans men. We mean non-binary people who were assigned female at birth. So these recommendations apply to all of those folks. And not in all the recommendations yet, but people who are trans women, people who are assigned male at birth, but are now taking hormones to reaffirm their gender. So trans women who are taking hormones, we're still figuring out their breast cancer risk, but that's a good conversation to have with your healthcare provider too. So many things to think about. Biggest take home is if you're not at any special risk, start at 40, but go talk to your healthcare provider to find out if you are at increased risk. Okay, so what are the breast cancer screenings? I find that pretty much everyone's familiar with the idea of a mammogram. Not everyone knows exactly what we're doing when we do a mammogram. So to take a minute for that, so mammogram is your main breast cancer screening test. Some people are going to also have an ultrasound or an MRI. Get to that in a sec. So this was just a quick, yes, this should be covered by insurance. We even have a New York State law that says this should be covered by insurance. So whatever your doctor says is medically necessary should be covered by insurance in New York State. If you don't have insurance, there is the New York State Cancer Services Program, which will help you get free screening. And New York City Health and Hospitals also does sliding scale plans according to your income. So don't give up if you don't have insurance. And if you go to our website, you can actually learn more about this. Okay, so getting back to what's a mammogram. So it's actually a type of X-ray. And the goal of a mammogram is to find tumors when they're still so small that you can't even feel them. And the way it's done, if you haven't had one yet, or if you're a person who's not eligible for these typical screenings, so you're going to go in, you're going to disrobe, and you're going to have someone helping you. They're going to place your breast on a plate on the X-ray machine, and they're going to squish it and take an X-ray picture. And they're going to squish it this way, and they're going to squish it this way, and they're going to do that for each breast. And there's actually a little bit fancier option these days called a 3D mammogram, where not only do they take a picture, but they'll have the machine move around the breast, and it takes a whole bunch of low dose X-rays and it puts them all together and it makes an even better image. Why would you want a 3D mammogram? Well, we're still figuring out, are they really better than 2D mammograms? So there's a big study going on to look at this. But what we see so far is they seem to be better at finding breast cancers. They seem to be more helpful when you have dense breasts. I'm going to show you a picture of that in a sec. And they seem to lower the chance of being called back for more testing. There are a lot of callbacks for more testing. I will say most of the time it turns out to be fine, but if we can avoid getting called back and scared when it's going to turn out to be fine, that's good. So we think that the 3D mammograms are helpful, and we should know more about that as time goes on. Okay, and then what is it about dense breasts? So this picture helps, if you're not familiar, helps us understand, like, why do we care about dense breasts? So dense breasts just means that you have a lower percentage of fatty tissue in your breast. And that doesn't actually necessarily correlate with how much extra fat tissue you have as a person. Our breasts actually tend to get less dense as we get older. They're more dense when we're younger. But it's also just an individual thing. Some of us have them, some of us don't. And so you can see on the left, that's a less dense breast, and on the right, that's a more dense breast. Well, what are you looking for on a mammogram? Tumors tend to show up as white spots. So you can imagine it's a lot easier to see the white spots that shouldn't be there on a less dense breast. So that's why we care, because it's harder to tease out, is there a tumor there for the breast on the right? And as we see on the slide, about half of us have dense breasts, so relevant for a lot of us. If you have dense breasts, there's actually a federal law and a New York State law that says your doctor has to let you know. There's actually an updated version of this language that I think New York State is now using, but fundamentally you should get a letter that says you have dense breast tissue. It's very common. It can make it harder to find cancer on a mammogram. It's, we think, connected to an increased risk of breast cancer. And this is so you can talk to your doctor about whether you might need an extra screening test just to check and be sure that you got a good screening. So one of the things that sometimes gets recommended for women with dense breasts is an ultrasound. Ultrasound also gets recommended when they find something on the mammogram and they call you back because they want to take a closer look. So an ultrasound can help it can help look into what was that on the mammogram. Is that really something to be worried about? Also, sometimes a woman will feel a breast lump, but it's not showing up on the mammogram. So an ultrasound can let us have another look. And I cannot say for sure that an ultrasound is necessary in addition to the mammogram. If you have dense breasts, we are still figuring that one out too. But a lot of physicians will say, you know what, let's just do them both. So don't be surprised if that comes up, and don't be afraid to ask about it. Okay, and then where do MRIs come in? So an MRI is another kind of test. It actually uses radio waves and magnets. It's kind of amazing how it works. And it creates an even more detailed picture of what's going on inside your breast. And those get recommended for women at particularly high risk of breast cancer. And Dr. Williams, if you are there and you didn't have to step away, I had actually asked Dr. Williams to pull out our info on who tends to get recommended for an MRI. Are you there, Dr. Williams?
Yes, I just had to charge my
Oh no. Okay. Do you want me to run through it or can you do it?
hold on one second.
Okay.
So for the MRIs, they're usually done in women at higher risk. Usually if they have about a 20 to 25% lifetime risk of breast cancer, or they have a genetic mutation in certain genes like BRCA, or certain syndromes such as Leishman syndrome, an MRI might be recommended. If there is even a known cancer, sometimes if they're wanted to do a biopsy as a next step, an MRI might need to be done before. And then anything else I'm missing, Dr. Seltzer?
Yeah, no, I think you got it. So, how do we know if we have a 20 to 25% risk, lifetime risk of breast cancer? There are actually calculators that your healthcare provider can use with you. They're good. They're good if you know your family history. So they're helpful in a lot of ways. One thing they can't help us with is if you have risk factors that aren't on the calculator. But that's what'll happen if you come in and you have a strong family history. Sometimes they'll actually sit you down and they'll run it through this calculator. Not always. Sometimes they'll just talk to you and say, "Boy, I think you need this." But that's just to give you an idea of when an MRI might come into all of this. All right, and we'll move on because I know we have limited time. One other thing we wanted people to know about is when does genetic testing come into the picture? And so it's not just women, actually, it's people. of all races and ethnicities can benefit. And the reason we say that is that sometimes people think, oh, like in medical school, we get taught Ashkenazi Jewish women, which actually I'm fit that category, have certain higher risk, or we hear that people from another group have certain higher risk, and we forget that actually anybody can have, say, the breast cancer gene. So we just put that in there just to say, you know, don't doctors shouldn't be counting you out just because of how you look. Um, and it's helpful if you have a really strong family history, lots of relatives. It's helpful if you know that someone in your family has one of the high risk genes for breast cancer. So then you can find out, do you have it? And we say women on this slide, there's actually increasing conversation about, you know, men can benefit from this too. So for men in the room, if you're like, I have a really strong family history, or someone in my family has this gene, don't hesitate to ask. It is a conversation that's worth having, to ask if this is something that you should do. Um, and then it's also helpful for treatment decisions. So if someone has breast cancer, genetic testing for you as the person who has breast cancer is actually helpful. Um, it can both guide treatment decisions, and it can help you know what to tell your family. And we bring this up because we see in studies of who's getting good care for breast cancer that not everyone's getting this. It's not being offered evenly. So we want you to know about it so that you can ask. All right. So I've talked a lot about screening. I've talked about prevention. What if you're in the shower and you find a lump in your breast? And men, if you find a lump in that area of your chest, listen to this too. So if you find a lump, you call your healthcare provider. You do not wait until your next screening. Don't just say, oh, it's probably nothing. Get it checked out. Because another thing that we see is sometimes people come in with advanced cancer because they didn't want to think it could be. So go ahead, get it checked out. The earlier we catch it, the easier it is to treat. So we're all, I think, familiar with the idea of someone finding a lump. What else could be breast cancer? What else should you get checked out? And you should know this list, and even finding a lump, it's not always cancer. There are plenty of things that are benign, or there are other kinds of problems. So just because you find that lump, or just because any of these things happen, it doesn't mean it's cancer. Do not panic, but get it checked out. So things to be aware of: a new lump, not just in your breast, but there's actually breast tissue all the way under your armpit. So breast or armpit. An area of thickening or swelling in your breast. It's not really a lump, but it doesn't feel normal. Noticing irritation that doesn't go away, or dimpling in the skin of your breast, like it's being pulled in. A change in your breast size or shape. And that's not just because we're going through puberty, but it's like, it's always been like this and now it's different. Pain in any part of your breast that doesn't go away. Fluid from your nipple, other than obviously if you're breastfeeding or having, you know, other discharge that's normal. So bloody fluid, clear fluid, just any fluid that shouldn't be there. Pulling in of the nipple. So the nipple used to stick out and now it doesn't. Or again, pain that's not going away. And again, really skin irritation, redness, or flaky skin that's not going away. And so, like I said, less common in women younger than 45, but it does happen. Much less common in men, but it does happen. So don't assume that you're too young, you're too healthy, you're not at risk. One other thing to know, I've talked a lot about family history. Most breast cancers occur in women who do not have a known breast cancer gene. They can occur in people who don't have a family history. So again, even though we can do a lot to assess your risk, we can't do everything. So be aware and don't hesitate to get checked out, and don't hesitate to get screened. Okay, just a couple more things. If you need to schedule a mammogram, your regular healthcare provider can refer you. Oh, and I see we have a question. I'll get to it in 1 second. There are some places around the city that will allow you to schedule a mammogram without a referral. If you do that, I would make sure to give them the name of your regular healthcare provider so that they get the results and they can help you if there's a problem. And again, if you don't have insurance. And Joan, go ahead. I don't want to move on if you have a question about this particular thing. You'll just need to unmute. Joan, you're still on mute. I'm not sure if you realize.
Sorry about that. First, I want to thank you for your presentation. It was terrific. Is there any age where you can stop getting a mammogram?
Oh, good question. The American Cancer Society says as long as you're in good health and your life expectancy is more than 10 years, that it's still worth doing. The U.S. Preventive Services Task Force says, we've really studied it up through age 74. So their take is we don't really know enough about what to recommend when you're older. But the American Cancer Society says keep going as long as you're in good health. So I'll give you that. And then I would say again, talk it over with your individual, your regular healthcare provider.
Okay, so what if
Yeah.
you're over 80, then you should be okay.
I would talk to your doctor because, as we get older, we also have to take into account, are we healthy enough to have treatment? Would we want treatment? So if you're in good health, American Cancer Society might say, yes, go ahead. But I don't want to make assumptions about your health or how much risk you're willing to tolerate or what you would choose. So I would say it's a great conversation to have with your own healthcare provider.
And also, is there any proof or indication or studies where a generation is skipped getting cancer?
You mean like with family history?
Yes.
Oh, that's a really good question. I mean,
That I've never heard of. And I was just wondering if if there has been any studies where a generation is
skipped.
Has many victims of cancer, and then the next generation doesn't get it, and then the following generation does.
I mean, I would have to honestly look and see if there are studies on that. I know that different genes have what we call different penetrance. So, for example, if you have the breast cancer gene, you have a very high risk of getting breast or ovarian cancer. And the risk actually depends what variant of the gene you had, but you have a very high risk, but not 100% risk. So depending on what your family's risk factors look like, it certainly could happen that someone in a middle generation just doesn't get it. Beyond that, I don't know of any specific patterns where you're like, oh yes, it always happens like this. So that I'm afraid that I don't fully know the answer. I apologize.
No, that's okay.
Yeah.
Thank you for your help.
Yeah.
And again, thank you for your presentation.
Of course.
It hit on many questions that I had that you answered before I even got there. Thank you.
I'm glad. Well, and I got a couple more slides to run through. And then if you have other questions or other folks have questions, we'll do those too. So let me just run through the last couple. So I talked about scheduling. And then this is another one that comes up. Can I get time off work for screening? So it is worth checking with your employer. For those of us who work for the city, we are lucky enough to actually have a modest amount of time that we can use specifically for cancer screenings. And we just put on our timesheet, that's where we were. And there are other companies that do this, so it is worth asking. I would love to see this be something across the whole city. I think I read that there's a bill being discussed, but I don't know the status. I don't know if anyone else knows more about it. But it's worth asking your employer. Okay. What other questions do folks have?
There is one more question, right?
So there's at least one more hand up.
And you saw it.
Yep. So, Oshua Tizor, you can unmute yourself.
Hello, can you hear me?
Yes, we can.
Yes.
Thank you so much for the presentation. It was incredibly informative. So I'm a medical student and I have a strong interest in breast imaging and population health. And I'm currently doing my master's in public health. So I was wondering if there's any ways for me to get involved, volunteering or research wise. I'm starting my fieldwork project next semester. So I'd love to get involved and help the community out with volunteering or research.
Oh, send us your info. And I was actually thinking for the person, Joan, who had a question before, if you want to share your contact info, I'll try to get you a better answer. But I'll put it, I can go ahead and put my email address in the chat here if people would like to have it.
Yes, thank you so much. I'll send you an email.
Okay.
Thank you.
Yes, we can put mine in the chat as well.
Thanks, Dr. Williams.
Anyone else? Oh, yeah, go
Hi, this is Jeremy from the Community Board. I have a statement, a question, and a possible follow-up question. I see that just was raised. So BRCA2 runs in my family. Genetic testing is very important to us. I obviously also know my family's history, but not everybody knows their family's history. Does New York City recommend genetic testing for folks so they can understand if they are predisposed?
The health department, we don't have our own specific recommendation, but there are several organizations that have really good detailed recommendations about who should get tested. So folks want to look, the American Cancer Society has some good kind of what we see, plain language explanations. They actually have a lot of really good information if folks want to go to their site, but they have a whole section about genetic testing and who should be thinking about it. And then if you really want to get into the medical guidance, one of the ones I was just looking at today, the National Comprehensive Cancer Network has a whole guideline with really detailed advice. And they're just one group of experts. They're not the only ones. And a number of other groups have guidance on that too. So that's usually what we do is we help our local docs connect to the guidance, and then each person can talk it over with their physician.
I'm going to change my potential follow-up question to just a complaint that New York City offers healthcare plans to its employees that does not cover genetic testing.
Send me more about that. I would love to know more about that myself, because plans that are covered by New York state law, which is not everybody, actually should be offering it under, it's complicated. There's a whole bunch of caveats, but I would have thought it was covered. So I would love if you could send me more information about that, and I'll pass it along to the rest of the cancer team to have a look at.
Thank you. Yeah, there's another hand up.
Yes, go ahead.
Melissa Ortiz, you can unmute yourself. Melissa?
Can y'all hear me now? Sorry about that.
Yes.
Okay. So I'm a breast cancer survivor. And in the chat, I put some links for everyone that kind of followed what you were discussing. But I do want to state that on the New York State website is a list of the businesses the private businesses that offer the paid sick leave. But if everyone who's on here can implore to their businesses to sign on to that, it is an independent option of the employer to provide that. But city and state employees, all city and state employees are entitled to up to 4 hours to get their screening without charge to their sick leave. So
Thank you for highlighting that for the state too.
yeah, so I just wanted to make sure that you guys knew about that. That includes the Brooklyn Public Library staff, by the way. And if anybody wants to get a commercial entity or a private business, then they only have to put it in writing and then submit it to the state, and then their business will be listed as a business that offers that to their employees. I did also want to state that Puerto Rican women in Puerto Rico are dying at the highest rate from breast cancer, and that we have a huge demographic of Puerto Rican women with the Ashkenazi gene. So women should not omit themselves as for being Puerto Rican just because of the way our our ancestry line runs. But it's and some of us we do carry the gene. That's it. Thank you. Good night.
Yeah, no, thank you for highlighting that. And if I didn't say that clearly enough, I apologize. Thank you for highlighting that because right, we physicians, we were trained this way, right, Dr. Williams, to think about certain groups for that breast cancer gene, and we really should be thinking for everyone. We should not be saying, oh, you're this background or that background, you can't have it. So really appreciate you highlighting that.
Thank you.
No, I do have a follow-up question. If you want to get in contact with the mammogram pulse, is there any specific contact for any specific person that we can contact?
Yes, so the one that we help fund is run by the American Italian Cancer Foundation. You're welcome to reach out to me and I can help make that connection, or you can actually just go to their website and see how it works. And then, is it Mount Sinai, Dr. Williams, that also runs one? There's at least one other in the city. I think it's Mount Sinai.
Yes, I remember today we talked about it and you mentioned Mount Sinai has one as well.
Yeah, and their information is online.
Thanks so much. By the way, we do have a mammogram pulse in our district on December 11 from 9 a.m. to 4:30. The location is 4708 Fifth Avenue, Brooklyn, New York, and it will be run by Oak Street Health. The number, in case anyone is interested, is 877-628-9090. And to be eligible, you have to be 40 to 75 for this specific event. Just wanted to put it out. And no more questions.
I'll wait this hand up again.
We do have one more question.
Oh, two hands up. Melissa Ortiz.
Sorry. Also that van, I partner with them a lot. You can't already have had a mammogram in the last 365 days in order to qualify. And it does not matter. Your immigration status is irrelevant. They will screen you regardless of whether or not you have health insurance.
Thank you. That is also, people should not be afraid to call the state cancer services program. And they should not be afraid to call New York City Health and Hospitals because of immigration status. So yes, thank you.
One more.
Nope.
No.
Went down.
Okay. No more questions in the room? No? All right. With that, thank you so much, Dr. Seltzer and Dr. Williams for the great presentation, really informative and great content. Thanks so much.
Thank you for having us.
Thank you.
And with that, we will move to the public comment. So we have some people with, thanks so much to everyone else.
We have, forgive me if I butcher either of your names, I probably will butcher both. Ochu Tisor,
Yes, yeah.
it's your opportunity to speak.
Perfect. Okay. So good evening and thank you all for the opportunity to speak. My name is Achua Tisor. I'm a medical student at the Albert Einstein College of Medicine, and I'm also completing my Master's of Public Health at the CUNY School of Public Health. So today I'm here to speak about the New York City Council Bill Intro 1337, which was introduced in 2025. So this bill will require the Department of Education to give parents clear, accurate, and multilingual vaccine information at the start of every school year. So this bill includes basic facts on recommended vaccines, the illnesses they prevent, and where families can go for questions or appointments. The bill doesn't tell families what to do or how to influence their decision about getting their children vaccinated. It simply ensures that every parent receives trustworthy information in plain language, no matter their neighborhood or their background. So this matters for Brooklyn Community District 7 because Sunset Park, Windsor Terrace, and Greenwood Heights are home to many multilingual and working class families who face real challenges navigating the healthcare system. Many parents rely on schools for health information because appointments are limited and schedules are tight. And when information is consistently confusing or inconsistent, families often feel overwhelmed rather than supported. I'm a medical student here in the Bronx at Einstein, like I said before, and I've worked with many families on my PEDS rotation who talked about the lack of information, confusing information. So, and the parents that I speak with, a lot of them are not opposed to vaccines. They just want clarity, they want transparency, and they want information they can trust. So this bill would help provide that. So my request tonight is pretty clear. I just request that the Community Board 7 consider supporting this bill and encourage the city council representatives to prioritize accessible and consistent healthcare information for families in our schools. So that's pretty it. That's it. It's pretty short. Thank you for your time and for your commitment to the Brooklyn community.
And you said that intro is 1337?
Yes,
Thanks so much.
of course. Thank you.
You may have said it, I may have just missed it. Who's the main sponsor of that? Who introduced the bill?
Let me see 1 second.
If you have it there, it would be the first name that's listed on
It is, I believe, Shakar Krishan. Yes.
it.
Yeah, Councilman Shakar Krishnan.
Thank
Mhm.
you. More. Thank you.
Of course. Thank you.
Next person is Malet Shibre. You can unmute yourself now.
Hello, can you hear me?
Yes, we can.
Thank you so much for allowing both of us to speak today. My name is Mahalit Shibre, and I am also a graduate student pursuing a master's in public health, and I'm also a medical student. I would like to speak today because I'm familiar with what it's like to survive on tips and not be sure if my hard work will be fairly compensated. Unfortunately, this is a feeling that's all too familiar for millions of hardworking employees in New York City, including residents of Brooklyn, who are experiencing wage theft at the hands of their employers. I wanted to speak at this committee because the Health and Human Services Committee, we know that financial stability is a key social determinant of health. When workers are deprived of fair compensation through wage theft or unreliable tipping practices, their physical and mental health can suffer. Financial stress impacts access to healthcare, housing, nutrition, and overall well-being, which is why I wanted to speak today to discuss the introductory bill number 1182, which has been introduced this year in 2025. And this bill aims to address wage theft and increase tip transparency for workers. According to a report done by Economic Policy Institute in 2017, over 2.4 million workers in the 10 most populous states, including New York, are affected by lost wages, which has resulted in more than $8 billion in wage theft, with a growing number of consumers choosing to pay for services using cashless methods. Wage theft by employers has become increasingly more common as they leverage the lack of tip transparency for exploitative purposes. So the purpose of this bill is to increase transparency by requiring employers to provide daily gratuity reporting to employees that detail the amount of tips that were earned. Other provisions include clarifying the definitions of words like gratuity and tipped employee and adding a layer of legal protection for employees, as well as including the standard 20% as a tip option. Really, this just ensures that industry practices are modernized to match the digital economy where more consumers use cashless payment methods. As members of the community board, you have the power to amplify the voices of your neighbors and advocate for the protection of workers in your district. So my ask is really that you would consider formally endorsing the introductory bill, again, number 1182, introduced in 2025, and the council member Shahana Hanif was the author of this bill, and I believe it was co-sponsored by Sandy Nurse and Councilwoman Carmen De La Rosa.
Thanks for that information.
What was?
Thank you.
Thank you so much.
Additional hands. With that, we conclude the meeting today. Again, thank you to all the speakers here and the speakers that presented throughout our meeting for the time and energy you guys put on this. Thank you so much. And with that, I close the session. Thanks to everyone else.
Thank you for having us.
Thank you.
Thank you all.